Hello, I'm Michelle Krupa. I'm one of the outpatient physical therapists here at Lake Huron Medical Center. So today we're going to address the topic of cancer-related fatigue. So the National Comprehensive Cancer Center has a formal definition of cancer-related fatigue, but in general, it's a sense of persistent exhaustion, weakness, and fatigue that patients describe during, before, and after treatment for cancer. In the literature, you can see that anywhere from 40 to 99% of all cancer patients experience fatigue. It is the most common complaint of cancer patients, and yet it still seems to be one of the least likely addressed complaints, almost as if it were an anticipated side effect of treatment. So that being said, there are solutions for helping patients who are experiencing this debilitating symptom. Most patients will describe fatigue even at diagnosis, during treatment naturally, and as treatment progresses. Some patients, and this means very few patients, will experience symptoms way beyond treatment, even up to a year beyond treatment. Most often though, those symptoms are acute and can resolve with time. We do have some amazing treatment approaches for that. We prefer a multidisciplinary approach to treatment. With multiple disciplines involved, we can look at everything from diet, nutrition, hydration, sleep patterns, biologic effects, so lab work, as well as exercise performance, functioning, and what we do as physical therapists to address that particular deficit regarding functioning. A good candidate for physical therapy would be somebody who is reporting fatigue. And in general, if you consider a scale from 0 to 10 and your experience of fatigue is 4 or higher, this is absolutely something you should be addressing with your physician. Additionally, physicians need to be screening for this side effect on a regular basis. So as the patient progresses through treatment, that experience of fatigue may become increasingly worse, affecting their daily activities. So most everybody is a potential candidate for treatment, although we do have some very specific precautions and contraindications to treatment. That needs to be evaluated on an individual basis, and that can definitely be done through your physical therapist. Right, so when we talk about fatigue, we all experience fatigue, and actually some of us more than others, and this can be a regular occurrence. So cancer-related fatigue, what distinguishes that from generalized fatigue is that this cannot be relieved by rest or sleep. So the experience of fatigue actually is disproportionate to the activity you're performing. So these would be good candidates for intervention. Certainly after you have indicated to your physician that you are experiencing a level of fatigue that can't be relieved with rest, he or she can suggest physical therapy. A prescription is necessary to obtain an evaluation through us here at Lake Huron Medical Center. That prescription should indicate your specific cancer type, as well as the diagnostic code of R53.0, which is specific to cancer-related fatigue. So the physical therapy evaluation consists of an extensive history. So we look at your subjective reports of fatigue, the actual stage and extent of your disease, what treatments you may or may not have received, what treatments you will be anticipating in the future, and then any additional labs or films that we can obtain to help adequately treat you. We look at vital signs specifically, and we look at your tolerance for exercise. We do some specific testing to see where you are functioning, and then from there we develop a very specific treatment program that first and foremost is safe, second is specific to your needs, and third relates to function. How the treatment plan we put together will improve your physical functioning. There are some absolute contraindications to treatment that we will screen for. There are some precautions, and then there are some side effects that we specifically look for. So each individual has a tailored prescribed program that meets their needs. We know from research that in general, exercise is the #1 modality for prevention of illness and propagation of health. Is this true for the cancer patient? And the answer is yes. exercise seems to be the number one modality to improve overall health. So patients who are experiencing cancer-related fatigue can still gain strength, gain cardiovascular endurance, balance, and flexibility through a safe treatment approach. So it is interesting too, because patients sometimes will come to us, maybe they've been a 20-year smoker, so they already have underlying disease. So you're already kind of behind the 8 ball, if you will, but certainly they can be significantly impacted by what we do. So you have to really take a good history. We need to know what you've been contending with prior to this diagnosis, now what you're contending with during this diagnosis. So the treatment approach is very specific. And like I said, we're very diligent about calculating target heart rates so that we can keep things safe and yet enough taxation that we're going to see benefit or improvement in your physical functioning. This is a very evidence-based approach, so I think it's also safest. Sometimes generically physicians will say, hey, I heard it's a good idea if you keep moving, but they just don't know how to guide you. How much movement, how often, what should I be experiencing? Is this enough to help, or is this too much? The way we approach it is very exercise physiology based, and it's very evidence supported. So I think it's the safest option for patients. It's comprehensive, and certainly it's multidisciplinary. So with the support from the other Lake Huron Medical Center physicians, we can address things like dehydration, we can address anemias, we can address nutritional intake, emotional support, and sometimes even biologics. Can we help you with an immune issue that we have a medication that would help with? So those are all things that we look at jointly, and I think with that team approach, you have the best outcome and the best opportunity for the best outcome. So statistically, if you look at the numbers, fatigue appears to be a side effect that is inevitable. However, suffering from fatigue does not have to be in your profile. We're offering a solution for that. So here at Lake Huron Medical Center, our goal is to help you improve your lifestyle, improve your physical functioning, and restore your energy. Through this process, you gain control over your own life again. So the phone number here at our department is 810-216-1800, and you can access our department through our fantastic scheduling staff who will assist you in getting an appointment to be evaluated.